Okay, thank you.
Thank you. Good afternoon. I'm very proud to be here with the House Democratic leadership. The unity of our House Democratic members was a very important message to the country that we are very proud of the Affordable Care Act. Yesterday, as you know, was the 7-year anniversary of the President signing the bill, and the American people expressed their support for it. That message became very clear to our colleagues on the Republican side of the aisle. Today is a great day for our country. It's a victory. What happened on the floor is a victory for the American people, for our seniors, for people with disabilities, for our children, for our veterans. Also, it's not just about the 24 million people who now won't have be off of health insurance. It's about the 155 million people who receive their health benefits in the workplace, who will not be assaulted by some of the provisions that the Republicans put in the bill, especially last night when they removed the essential benefits package. So again, it's pretty exciting for us. Yesterday, our anniversary. Today, a victory for the Affordable Care Act, more importantly, for the American people. Tomorrow is the 51st anniversary of Reverend Martin Luther King Jr. saying in a speech that Mr. Clyburn quotes often to us, that of all of the forms of inequality in health care is probably the most inhumane and can sometimes lead to death. That was the spirit in which we came into this debate, honoring the vows of our founders of life, liberty, and the pursuit of happiness, a healthy life, the liberty to pursue our happiness. So it's about our country, and the vision of our founders. It's about our faith, and it's about the unity of the Democrats, united by our values. And with that, I'm pleased to yield their distinguished majority. Not sorry. Democratic whip.
Not yet. This is a good day for the American people. We worked over years to assure that the American public would have access to affordable, quality health care. We went a long way towards that effort in 2010 when we adopted the Affordable Care Act. Much of the credit for passing that bill goes to then Speaker Pelosi, now Leader Pelosi, who was indefatigable in her advocacy for assuring that every American would have the security of having the availability of health insurance. This bill went down today. It went down today because the majority of the representatives of the American people in the House of Representatives thought this was a bad bill. Went in the wrong direction. Left 24 million people behind. Raised costs for seniors between 50 and 64 very substantially. And everybody else would have paid more and gotten less insurance. And in fact, it was made worse last night, where the requirements for covering essential services was essentially gutted. But the American people are still going to rely on us to have that security. And I hope that we can work with the administration and with the other side, and not just abandon this effort, and not make efforts to destroy indirectly what we did not destroy directly today. That's our responsibility as Republicans, as Democrats, sent here by our people to try to make their lives better. Make sure they had jobs, make sure they had health care, make sure that they lived in a safe country. We will not abandon that responsibility. We trust that our Republican colleagues will not either. And I'm pleased now to yield to my dear friend, the Assistant Leader of the Democratic minority, Jim Clyburn of South Carolina.
Thank you very much, Mr. Whip. I joined Leader Pelosi in observing the words of Martin Luther King Jr. when he spoke on this issue back in 1966. It's kind of interesting, Madam Leader. King used two words. He said it was inhumane, but he also said it was egregious. Egregious and inhumane. Nothing can be more egregious, in my opinion, than saying to a child born with diabetes, you can never get insurance coverage on your family's policy. Nothing can be more inhumane than saying to a man with prostate cancer or a woman with breast cancer that you have run out of treatments and you can no longer rely upon your insurance for treatment. I think that what happened here today is the fact that a majority of the members of the United States House of Representatives saw how inhumane and how egregious this manager's amendment would be for this very, very important area of all of our lives. All of us have had real personal experiences with the need for health care and for treatment. And all of us know that no one of us can guarantee that we will never have a need for these kinds of treatments. And so I am pleased and hopeful that this step today will be a step toward the continuation of a more perfect union, the building of a more perfect union. And hopefully we can do that very soon with making the Affordable Care Act a better piece of legislation in a bipartisan way. And with that, I'll yield to our chair for our focus.
Thank you, Mr. Blackburn. If you sense a little bit of exuberance on our part, just a little bit, it's on behalf of the American people. The victory here today, the defeat of this legislation is a win for the American people, for not only the 24 million Americans who stood to lose their insurance, but for all Americans who have insurance today and those who want to have insurance. This is a big victory. We did listen to Mr. Ryan's press conference. We did listen to him about what lies ahead for the Affordable Care Act, which he has said is the law of the land from here on out. Just remind that law needs nurturing, not neglect. He mentioned something in effect of letting it may fall on its own weight. But we can't let that happen. He has a responsibility, we all have a responsibility to keep this law and nurture it, keep it moving. But I want to thank the Democratic Caucus for its unity, for sticking steadfastness and staying together as the chair. And one little point of personal privilege, and that is on the issue of New York. There's another provision in this, the Empire State Kickback, the Buffalo Bribe. You can fool New Yorkers sometimes, you can't fool us all the time. And today, New Yorkers were not fooled, and they weren't able to pull this off because it was the wrong thing to do. And with that, I want to recognize the General Aide from California, the Vice Chair, Linda Sanchez.
Thank you, Chairman Crowley. Today's lack of vote is indeed a temporary victory for the American people. For 7 years, Republicans have made promises about repealing the Affordable Care Act, and today they could not deliver. They had 7 years to come up with their so-called better way, and now it turns out that they've been bluffing all along. The American people sent a clear message today. If Republicans want to repeal the Affordable Care Act and take away health care from millions of people, they do so at their own peril. But if Republicans are serious about wanting a better way for health care, they will work with Democrats to improve the Affordable Care Act so that we can make provisions that are problematic better. But we will not stand idly by and let them tear apart a piece of legislation that has had such a tremendous impact on so many people. They love to knock the Affordable Care Act, but the fact is it's increased coverage for 20 million Americans, and it has improved quality and lowered costs for more than 156 million people that get their health care through their employer. So we breathe a sigh of relief, and that sigh of relief is on behalf of the American public. We see bills periodically that are bad policy, but the bill that would have been on the floor today for vote was just plain heartless. And we're so glad that we didn't vote on that legislation today.
Speaker Pelosi, to follow up on what your three colleagues just said, you all said you want to work with the administration to try to help the law survive and thrive. You know Donald Trump, you know the Speaker. In the real world, what would you say to families who say Washington's gridlocked? We've never seen Nancy Pelosi and Donald Trump work together. How in the real world is that actually going to happen?
Well, I worked together very closely with President George W. Bush in the minority and as Speaker of the House. We passed the biggest energy bill in the history of our country. We passed PEPFAR, a great humanitarian effort of which the President is also very proud. We passed the infamous TARP, which I think is really why we lost the 2010 election. We passed bills that, Barney Frank, they were the most progressive bills in terms of tax refundability to low-income working people. The list goes on and on. So it's not a question of what the American people have seen me do with Donald Trump. It's what we did as a matter of record over a long period of time, even though we had our disagreement. In my case, on the war in Iraq, what could be worse than that? But we always stand open. We have a responsibility to find common ground, find common ground. But if it depends on the motivation. If the motivation is spite that they were going to pass this bill yesterday because it was the 7th anniversary of the Affordable Care Act, instead of taking the time to develop legislation, to perhaps hear from experts by having hearings, hear from families by having hearings and the rest, and develop something within their caucus, and perhaps in a bipartisan way, hopefully, they might have had a bill that would be successful. Instead, as I said before in this room, they decided to pick a day, and instead of deciding when they had the votes to bring it to the floor. Speaker says it came close. We'll never know. We'll never know. We had a big, long list of no's that we were seeing, and so I don't know how close it would have been. But let's not lose any more faith for them than now stood up today. But the fact is that we have a responsibility always to work on it. But right now, quite frankly, the reason that they lost is because of actions they took or did not take, but it's also because the American people weighed in. Our phone lines were all deluged. I want to thank all the people who expressed themselves to members of Congress, either say thank you for supporting the Affordable Care Act or kill the bill, whomever they were calling. So let's just for a moment breathe a sigh of relief for the American people that the Affordable Care Act was not repealed, which was their goal on the 7th anniversary.
Congressman Scott, can you comment on that issue of whether or not you think the Republicans would ever work with you on your committee of jurisdiction? Can you just comment on that generally?
We've worked together with Republicans, with George W. Bush, No Child Left Behind, and last Congress, we fixed the problems with that with Every Student Succeeds Act, so we're able to work very effectively together. The problem with this legislation is that it tried a debating technique that goes that there's a problem, I have a bill, if you don't like the way things are, therefore you must be with my bill, without ever saying how your bill will improve things. I think people saw through that and noticed that the legislation before us, by any objective standard, made things worse. And it couldn't, and the Republicans didn't want to vote for it. Obviously, the Democrats didn't want to work for it. If you're going to improve, we're all for working together.
Speaker Pelosi, on November 9th, when you kind of looked at the path ahead, did you expect that in under 100 days of the Trump administration, they would be done and moving on from health care unsuccessfully?
Quite frankly, I thought they might have accomplished something in the first couple of months. I remind you that President Obama took the oath on January 20th. He asked for swift, bold action now on jobs and education and the rest. And 1 week and 1 day later, the House passed the ARRA, the American Reinvestment and Recovery and Reinvestment Act. 1 week later, the Senate passed it. 4 weeks after his swearing in, he had signed legislation to create or save 4 million jobs. He'd already signed the Lilly Ledbetter Act, the S-CHIP Act, State Children's Health Insurance Program, and other things. They have absolutely no record of accomplishment except maybe to take away clean air protections, safe water, drinking water protections, and the rest. So I would have expected that they would have done more, but I think their mistake really was, they were so focused on embarrassing the Affordable Care Act rather than trying to improve it.
Leader Pelosi, you'd rather have them do it.
Make one comment to your question. The President of the United States looked all America in the eye. And he did it through the lens of course, the TV camera just a couple of weeks ago in what was his State of the Union. And he said, I'm going to give you a health insurance program that covers every American at lower cost and better quality. I hope he meant it. We cannot abandon that effort to make sure that every American has health care, security, at lower cost and better quality. That was our intent in the Affordable Care Act. We think we've come a long way in accomplishing that objective. But we can do more, and we ought to.
Members of the Progressive Caucus yesterday expressed hope that the death of this bill might renew discussions of Medicare for all or a single payer, move in that direction. Do you feel like that the party may be ready to move in that direction now?
Well, when we did the Affordable Care Act, I wanted the public option, as I think everybody knows. We didn't get that, but we mitigated for not having it by having provisions in the bill that enabled people to receive benefits. The single payer or the public option would have saved more money. It would be cheaper because of not so many administrative costs. But right now, we couldn't get that when we had a Democratic president and a Democratic Congress. So what I've said to my friends, and many of them are my constituents, is there are a couple of things that we can do for the Affordable Care Act that are very important. One of them is to continue the reinsurance that we had in the program to begin with, to see if the Republicans would be willing, instead of being an obstacle to its enforcement, by stopping the release of funds that would help in the high-risk corridors, because that money was there, and that would have helped with the insurance companies in high-risk corridors, some of those things. And one thing that the president talked about in the campaign that would help continue to lower cost, although they're rising at the lowest rate of increase in the 50-year history that it's being measured, is to work with us to make sure that the Secretary of HHS is able to negotiate for lower prices with the pharmaceutical industry. And prescription drugs are the biggest reason for the increase in medical costs.
Leader Pelosi, President Trump has just spoken about what happened today, and he acknowledged they came up short. Also said that now you and Chuck Schumer own Obamacare and whatever.
We did. We proudly did.
He is open to working with you.
Did he blame us for the defeat of his?
He blamed you for not
flagship
casting votes
issue?
in support and says he wants to work with you.
We'll take credit for that.
But
We'll
he
take
says that
credit
you
for
own it now, and that if there's a way to repair some of the things that many of you would acknowledge need some tweaking, that he wants to work with you. What's your
Wonderful.
reaction?
That's good news. That's good news. But I have news for him. Perhaps he wasn't aware of this. We did take great pride in the work that we've done. And I accept Mr. Hoyer's statement earlier about my role, but I accept it on behalf of all of the congressional Democrats who had the courage to make the vote. Because we're very, very proud of it. Again, honoring the vision of our founders, life, liberty, pursuit of happiness, honoring our faith-based initiatives to just minister to the needs of God's creation as an act of worship.
I can't resist. I'll be out to many of my colleagues. I can't resist responding to the president. I thought we owned it yesterday and the day before and in November. And I want to remind you, notwithstanding his alternative facts, more people voted for the candidate who was for the Affordable Care Act than people voted for the candidate who was against the Affordable Care Act. That's called democracy. The Electoral College didn't have that result. I get it. But more people in America voting for president voted for the candidate who wanted to keep the Affordable Care Act.
Leader Pelosi, how would you assess the...
And I'll just say to that, unified Democrats did defeat this bill, and we did it for the American people. We did it because we heard them, we fought for them, and today we won for them. And I'll just say our future 4 members, our 26 youngest members, we've gone to 37 cities now, and what we've heard across the country is that young people were going to suffer tremendously under this, with a surcharge in having a lapse in coverage. And this economy is so unstable for young people today that to have 30% surcharge hanging over their head would create so much financial distress for them that they couldn't have this bill. So they were snapping us, Facebooking us, tweeting at us, and old-fashioned phone calls were coming into our office. And so we fought for them, and we're going to keep fighting.
Madam Leader?
Last question.
On the politics of this, I do have to ask if this outcome helps your path to take back the majority more than had they had the vote, and also I'd like to hear from Chairman Lujan on this as well.
Well, why don't we start with Chairman Lujan, but in that regard, I think if I just may be allowed a personal view of politically in this room, I think they pulled the bill because they're going to have a lot of no votes there. And the ones that would be voting yes would have great exposure because, as Mr. Horner said, 56 to 17 was the poll on this. 17, and by the way, in that poll, 12% thought the bill would be good for them. This was not a very good bill, as has been said. It was a tax bill disguised as a health care bill. The biggest transfer of wealth in the history of our country, of several hundred, 600 billion or more, $600 billion or more, going from working class families to the richest people in America. And by the way, having 24 million people now not having access to health insurance, and at the same time undermining Medicare and jeopardizing the pre-existing condition benefit that we had in our bill as they repealed the essential benefits. One of the most interesting speeches to me on the floor was when one of our colleagues, whom I love and respect, and by the way, I grant everybody their position, and we have a debate on it, but at least admit that you have a bad bill. I mean, and one of my colleagues got up and he said, I was really not for the bill, but they really made it better last night where they repealed the essential benefits in the bill. I thought, oh, okay.
Just make no mistake, today's about the American people. And the reason this bill went down was because thousands and thousands, if not millions of people have been gathering around America demanding answers to why Republicans were doing what they were doing. Why Republicans had such a terrible bill in front of them that was going to devastate working families. Put an age tax on people over 50 years of age. This was devastating. This was going to force states to have to increase taxes, ration care, and throw people off the health rolls. That's what today was about. But don't forget, there were also 15 Republicans that are in some of the most competitive districts in America that voted yes on this bill. In the Rules Committee, the Ways and Means Committee, the Energy and Commerce Committee, and the Budget Committee. And their constituents deserve answers as to why they were voting yes on this bill, which was horrible then, it was horrible today. And we'll continue to take this fight to the American people. But I want to thank the very constituents across America who made today possible. Today is their victory, and we're going to continue to reach out with them, work with them, earn their trust, and maintain their trust all the way through November of 18.
Thank you.
So the president's really excited to work with you. No.
Yeah, right. I want you to go.